Bridget. I'm a PA student at Jefferson. What's your name?
Hi, Bridget. I'm Precious.
Precious, it's so nice to meet you. I'm just going to take a seat. All right, so what brings you in today, Precious?
Well, I'm been a little ill, and I don't know if it's my allergies acting up or what, but I've been having some problems for the past 4 days. Sore throat.
Okay.
And my glands seem to be a little swollen.
Your neck
as well.
hurts?
Yeah, it seems to be a little swollen. And some fever. So I just don't know if that's like maybe like seasonal allergies or something like that. Maybe I'm coming down with a cold or a flu or something, but I just haven't been feeling well.
All right, well, I'm going to ask you a bunch of questions and we'll try and get to the bottom of what is not making you feel so good.
Okay.
So you said you've had a fever. When did that start?
That started about 4 days ago.
4 days ago, okay. And have you tried anything to make the fever feel better?
I've taken like some Advil or something like that, and it goes away, but then it comes back.
Sure.
So it's like it never goes completely away, but I do feel a little better as far as like a little, I don't feel as hot, and put it that way.
All right. So did you notice that you were doing anything specific did you notice that when the fever started?
No, I just woke up actually that morning.
Oh,
and
so
I
you
was
woke up in the morning
warm.
with it?
Yeah, I was feeling warm when I woke up that morning. And like I said, that's the sore throat. All that was just, it was, like I said, about 4 days ago.
Okay. Does you notice that the fever's worse when you're doing anything?
No, because I actually don't feel like doing anything. So I just kind of been
Okay.
laying around and sitting around.
Sure.
So it's not been any change or anything.
Okay. And for the sore throat, how does anything make that better? Have you tried anything to make that feel better?
Actually, my mom told me to put some like green alcohol on my throat,
Okay.
to try to get
Like a home remedy that your
the
family
home
uses?
remedies, and gargle my throat with like warm salt water or baking soda water. So I've been kind of doing that, but nothing's like helping.
Does anything make it worse, like talking or anything?
Talking, it hurts. It does bother me when I'm talking.
Okay. And on a scale of 1 to 10, how bad is the sore throat, with 10 being like the worst thing you've ever felt?
I'd probably say like at least a 7, maybe
7,
8.
and what's your 10? What's the worst pain?
Oh, okay. Oh, the worst is probably like 7.
Okay. All right. So, and that started 4 days ago as
Right.
well.
Mm-hmm.
All right. And is there, have you ever had anything like these symptoms before? Have you ever had like this combination of symptoms before?
Only when I have, when I'm coming down with like my seasonal allergies or something like that, or some kind of common cold. But the difference is I don't have the stuffy nose,
No
like
stuffy
that.
nose.
Yeah.
Okay. And have you so this all brought you in, started 4 days ago, and have you been like in the hospital for anything or anything like that recently?
No, I haven't.
Okay.
I actually haven't.
Do you take any medications?
Yeah, I do take medication. Take medications for high blood pressure.
What do you know what the medication's called?
Hydrochlorothiazide.
Okay.
25 milligrams.
And that's a tablet?
It's a tablet. I take it once a day. And then I take some medication for anxiety, and I don't really know what the Cymbalta is the
Cymbalta is the name
regular
of it?
name,
Sure.
yeah, but I have the generic. And I take that once a day. And
Do you know how much of it you take?
just one
Tablet?
I don't know
Not the
I don't know
milligrams? That's fine.
And I take a multivitamin. Well, actually, I take vitamin B complex. I do that one.
Okay.
And let's see, I take Ginkgo biloba just for memory. Because I'm a little old here, so I just like, and I'm in school, so student. So I just
Student?
Yeah,
Awesome.
yeah, older student here. So I try to get something to help me to think better, remember for memory. And let me see, what else do I take? Let's see. Oh, and I take metformin.
Metformin?
Yeah, metformin. I don't know the milligrams or anything like that.
Okay.
Yeah, but I take the metformin for weight loss. I'm not diabetic or anything
Not
like
diabetic,
that. Yeah,
okay.
they try to help me to see if that would help me lose weight.
And are you allergic to anything?
No, not that I know of. I'm not allergic to anything.
Okay. And now I'm just going to ask you some questions about your past medical history. How was your childhood health? Were you a healthy kid, would you say?
I would say I was mostly a healthy child. Only thing that I can remember having as a child was a childhood disease called impetigo.
Okay.
Yeah, that was like sores and they were contagious and it was like had pus in them and when the pus were, you probably know your PA, but yeah, I had impetigo as a child. I remember that, but that's about it.
Did you have any measles as a child?
I don't remember if I had measles. I know I did have mumps
You
and
had
chickenpox.
mumps and chickenpox. What about rheumatic fever?
No,
Scarlet fever?
no,
Polio?
no.
Any sort of psychiatric disorders as a child?
No. As a teenager, I was in a psychiatric hospital
Okay.
for 6 months.
Okay. And what was your diagnosis then?
Anxiety, depression.
Okay. Thank you for sharing that with me. I know it's not something that's super easy to talk about. Do you remember getting like childhood immunizations, like shots when you were a kid?
I did.
So, do you remember like specifically if you got like the polio vaccine and like MMR?
Not sure. I'm sure I got all that I needed.
All that you needed.
Yeah.
Okay. Yep.
Mhm.
And as an adult, how would you say your health is?
I would say overall my health is okay. I just recently had, about 2 years ago, I had shingles.
Okay.
And then it prompted Bell's palsy, but now I have Ramsay's Hunt, which they said is kind of permanent now. If you can see my kind of crooked smile here, yeah, from the Bell's palsy and Ramsay's Hunt. But yeah, that other than that, it's okay. I do have a history of polycystic ovarian syndrome as well, PCOS, and I also have right branchial bundle block.
Okay.
So I see a cardiologist
Cardiologist?
once a year for that.
Okay. Glad you're taking care of
Yeah.
that. Any history of hypertension?
Yeah, I have hypertension.
Okay. Yes, we talked about the meds for that. Hyperlipidemia? High cholesterol?
No, I don't have high cholesterol.
Okay. Depression, do you currently have depression?
I think I have more of anxiety than
Okay.
depression, yeah.
And are you seeing any cognitive behavioral therapy or a therapist for that? Do you meet with anyone?
Before I relocated and moved here, I was seeing a psychiatrist, but since I moved to this state, I haven't found one yet.
Okay. And any history of thyroid diseases?
No.
Any?
It runs in my family.
It runs in the family. Any sort of heart disease like a
That runs in my
MI?
family, but not for me. For me, with heart, the cardiologist stated that the right branchial bundle block that I have is not really a heart condition, but I do have that. And then he said that I have, for my bicuspid valve, I have a minor leak, but it's nothing to worry about right now.
Okay. Coronary artery disease?
No,
Any sort of like heart attack, myocardial infarction?
no,
Angina, like pain with exercise in your heart?
no,
Okay. Any sort of lung disease like asthma,
no, I don't have,
chronic obstructive pulmonary disorder, also called COPD,
no,
emphysema?
no,
Have you had any cancers?
no,
Any renal disease?
no,
Any HIV,
no,
hepatitis?
no,
And have you ever had a blood clot?
no. I will say, with the pulmonary anxiety, every year I do get chronic, what do you call it here? Chronic
Like bronchitis?
bronchitis.
Okay.
Yes, sorry.
That's okay.
I get chronic bronchitis every year.
Okay. Do you see a pulmonologist for that?
No, I don't. Just the
Just
primary
primary?
care doctor. They call it chronic bronchitis or chronic sinusitis and chronic sinusitis. So I get that.
Have you had any accidents or injuries?
No,
No broken bones, car accidents, anything like that?
not recently. No car accidents.
Okay. And hospitalization, I know you said you had a bypass?
Yeah, I had the not bypass. I had the let me see, gastric sleeve
Okay.
surgery
When was
about
that?
3 years ago.
Okay.
And I lost 84 pounds, but
Wow.
I've gained about 30 some back. I've had also surgery twice for ovarian cysts
Okay.
that were removed.
And then when was that surgery?
That surgery, well, I had two of them, one in 2007 and one in 2009.
And they were the same doctor or different doctor?
Same gynecologist.
Okay.
And then I had ectopic pregnancy in 1987. And one of my fallopian tubes were removed because it ruptured during the surgery.
Okay.
And then, you know, of course, my tube's been tied. I had that surgery as well.
Hysterectomy. So,
I had hysterectomy and I had a tubal ligation.
okay. So, where did you have your gastric sleeve done? Do you remember the hospital name?
Presbyterian Hospital in North Carolina.
Okay. And do you remember the doctor?
His Dr. Vollinger.
Any sort of complications from that, or?
No.
Okay. And then for your ovarian cysts, do you remember what hospital that was?
Presbyterian Hospital.
Okay. And the doctor?
Dr. Page.
Page. And have you had any complications with that?
No.
Okay. And for the ectopic pregnancy, you said the complication was the tubal ligation ended up?
Correct.
Okay. And do you remember the doctor for that?
Snyder.
And which hospital was that?
That was at Carolina's Medical Center in North Carolina.
Okay. So as an adult, do you get your flu shot every year?
I get the flu shot every year.
Wonderful. And all the other vaccines that your primary recommends, like your boosters for hepatitis or chickenpox?
Well, I haven't had anything like that, but I've had the flu shot every year.
So but your doctor, you're usually up to date with your vaccines?
Correct.
Okay. Have you had any like screening tests done, like a colonoscopy?
I have colonoscopy done, and I have to do it quite often because I have precancerous. The first time that they did the colonoscopy, they found 7 precancerous polyps.
Oh, so you go pretty often then?
So, and then I just had another one done last August, and they found 6 polyps, but they were not precancerous. The
Okay.
doctor thought they were, but he wasn't.
Mammograms?
I have mammograms, and they are normal every
Normal
year.
Okay. The fecal occult blood test? It's usually a stool sample and they test it to see if there's
no.
blood in it? Okay. So psychiatric history. So you said you had a hospitalization as a teen.
Mm-hmm.
Any other hospitalizations?
Just with the surgeries.
For no other psychiatric inpatient or
Oh, no.
outpatient? So your diagnosis as a teen was
Depression, anxiety.
depression, anxiety. And how old were you?
I think I was 15 at the time.
15. So following up after did you see a therapist after that?
Yeah, I saw a therapist for many years, even up until my adult.
Okay, so, and you're taking the Cymbalta for that.
Yeah, but that was, well,
This is well after.
that's something that's kind of new. The Cymbalta, that I've been on that now for just some months, maybe like about 6 months or something like that.
Okay. Have you ever tried to hurt yourself at all?
As an adolescent, that was the reason for the psych. It was, trying to suicide.
Suicide.
Yeah, but nothing as an adult.
And thank you for sharing that. That must be challenging. So when did you have your first? I'm gonna ask you some questions about your gynecological history. It's something I ask all my female patients. So whatever you're comfortable with sharing with me, that would be great. Do you remember when you had your first period?
I think I was 12, I'm sorry.
12. Okay. And were your periods usually regular, irregular, painful? Did you have any symptoms with them? Do you remember?
No, they were regular.
Regular?
Yeah, regular.
Okay. And when was your last pap smear?
Because I had a hysterectomy, my last pap smear was 2000.
Okay.
The year 2000.
And did you ever have any abnormal results with your pap smears?
No.
Okay. how many pregnancies have you had?
I've had 4 and 3 children.
3 children.
So I had the ectopic pregnancy and then 3 live births.
Sure. So, were your children full term? Were they premature?
My first child was premature. Well, they don't consider it premature today, but when she was born.
Okay.
She's 36.
Any abortions, anything like that?
No.
Okay. And are you currently sexually active?
No, I'm not.
Okay. So now I'm just gonna ask you some questions about your family. Can you just give me like a picture of what your family's health is like? Healthy people?
I
or-
would say in my family, we predominantly have disease of heart disease. My father had bypass surgery, and he is no longer living, but he died of renal failure.
When did he, at what age
At
did he die?
85, I think.
Okay. How's
My-
your mom?
My mom, she's fine. She's 94 right now, and she's
Wow.
still living. She lives by herself, and she had quadruple bypass many years ago, but she's fine now. The only problem that she deals with now is blood pressure, but it is under control.
Okay.
But other than that, she's fine. She's still wearing high heel shoes and still fancy.
Oh, amazing.
My sisters, I have one sister that has diabetes. She does insulin.
How old is she?
She is, I think, 67,
Okay.
and she just recently, last week, they just did, they found that she had 3 blockages in her arteries, her heart. So they put a stent in one to open the one that was like 90, it was a little over 90% blocked, and the other 2, just a little block, so they'll open those eventually really soon. My older brother, he's in good health. Then I have another sister that's suffering with thyroid problem.
Okay, well, how old is she?
She is 65. She's suffering with hypothyroidism.
Okay, so.
And then I have another sister that just died about 4 years ago of cardiac arrest, heart attack.
Okay. And how old was she when she passed?
She was 55, and she was very obese. She's probably like, almost 600 pounds, but she's been obese all her life. And then I had a brother that died years ago of leukemia.
How old was he when he?
He was, I think, in his 50s to 57,
Okay.
and he died of leukemia. And this has been like, I think that was like 2000 and, I want to say 7, something like that. And then another brother that was killed when I was like 12.
So how old was he?
He was 23.
Okay. So you had altogether?
Well, my parents had 9 children,
Okay.
but it was 7 of us that lived, and then they had, I think, 2 stillbirths.
Okay. And were your grandparents healthy?
Yeah, for the most part. My paternal grandfather, he lived to be 93. My paternal grandmother, she died when I was a baby. In fact, she had a heart attack while she was holding me. They said she used to watch me when my mom worked, and she had a heart attack while she was holding me. And then my maternal grandmother died at age 99.
Wow. Longevity.
Yeah, and then my maternal grandfather, he died, let's see, I don't really know what age he was, but he died of, let's see, I don't know if it's colon, I don't think it was colon
It was a
cancer.
cancer.
Yeah, it was a cancer.
Okay.
He died of.
And then are your children healthy?
My children are healthy, yes, they are.
Any sort of medical issues happening there?
One of my sons I have 3 children. And one of my sons, which is the middle son, he was in the hospital in, I think it was April. They found out he had congestive heart failure, and he has high blood pressure. My daughter, right now he's 35.
Okay.
My daughter, she has a hernia that she needs to have done, but she declines to do it.
How old is she?
She's 36.
Okay.
And then I have another son, my younger son, he has a hernia in his prostate, and he just haven't had the surgery either. But that's
How old is he?
He's 33, sorry.
Anything else, like any sort of impressive things that you can think of in your family history that would be worth noting, like aunts or uncles? We don't have to go through everything they've had, just
No, just on my paternal side, my dad's side, it just seemed like most of those people are down with more
heart issues.
heart, blood pressure, and kidney failure. On my mom's side, it seemed to be more cancer
Okay.
related.
Now I'm going to ask you some questions about just your day-to-day life and some questions about drug and alcohol use. I ask all my patients these questions just because it's so prevalent in our society today.
Okay.
So where were you born?
I was born in North Carolina.
Okay. And what's the highest level of education that
I
you
have a
finished?
master's degree
Master's.
in marriage and family counseling.
Okay. And what do you do for work? You said you're a student.
Right now, I'm a student.
Okay.
Mhm.
And are you married, single,
I am divorced.
divorced? Okay. Are you, do you have any sort of barriers for your, like, how's your living arrangement? What do you live in?
Well, I own a home in North Carolina, which is being rented out, but because I'm here for school, I rent a house, and I share it with 3 other
Okay.
young ladies.
Is there any steps to get into the house?
Yes, there are.
Okay.
There are just very few steps, but then, because we have an attached garage to the house, there are several steps that you have to go down
Okay.
from the garage to go into the house, and then inside the house, we have several steps.
Okay. Any
So-
trouble with the steps in the house?
No, I don't. Just when I'm wearing my really high heel shoes and I want to feel sexy.
Do you have smoke detectors in the house?
Yes, there are.
Okay. And your cleaning products and medications, do you put them in locked cabinets?
They're not in lock cabinets, no.
Okay.
We're all adults. It's for
no
adults.
children
in there.
living.
No
So you
children.
said just roommates living in the house, no family members?
Right, just
Okay.
roommates.
How many cigarettes do you usually smoke in a week?
I don't
No
smoke.
cigarettes.
I'm a former smoker, and
Former.
I stopped smoking about 20 years ago now.
Wow, that's
and
so
yeah,
good for your
I was a
health.
closet smoker at the time, so
Okay. How much alcohol do you usually drink in a week?
I don't drink.
No drinking, okay. I know you're a student, but it's important that you get sleep, so how much sleep do you usually get?
Oh, that's a problem. Generally, about 6 hours a night.
Okay.
Yeah.
That's, what time do you usually wake up?
I usually wake up around 5:30, 4 to 6.
So you're going to bed around like
yeah, like
11-ish?
Yeah.
I mean, I know you're a
Because I'm
student, so
studying.
it's hard.
Yeah.
Do you exercise at all?
When I'm not studying, I try to get some exercise in. I love Zumba. I love Zumba.
That's
Yeah.
Do you use any illicit drugs like marijuana, meth, cocaine? anything
I don't
like
do
that?
drugs.
Okay. Do you have any firearms in your home?
No, I don't.
When you're driving in the car, do you wear your seatbelt?
Yes, always.
Okay. And if you're out in the sun, do you put on sunblock?
I don't put on sunblock. I usually don't sit out in the sun. If it's too hot, I find shade.
Do you drink any coffee or any sort of caffeinated beverages, tea?
I do, although I'm not supposed to. I hope. Yeah, I'm not supposed to because of the gastric sleeve surgery, but I will occasionally drink sweet tea. Yeah, that's about the only time.
Okay, so sweet tea. And how's your diet?
My diet is, I won't say it's great for the surgery that I have because I'm supposed to, as you know, do more protein, and that's supposed to be the first main meal, but I do protein, but I've been doing a lot of carbs here lately. So thus probably is the reason for weight gain and, not
Understand.
exercise.